Welcome to Conversations with Grownsy, where today we're answering all of your questions about night feeds, pumping on the go, and getting your milk supply ready to go back to work. We're talking with Ashley Robertson, who is a registered IBCLC. So let's dive into some of these questions. Can you tell me a little bit about your background, what got you into this profession, and what you love about it?
I've always been in healthcare. Then breastfeeding really with my daughter did not go the way that I thought. And that was not my journey with her. So throughout having my son about 4 years later, I jumped full board into breastfeeding and I was just researching tons about it. I was also getting my doctorate at the same time. And with that was researching the maternal child area. So it took my lactation consultant I had to tell me, like, hey, like, you have a lot of this background. You could do this. And then, once I got a taste for it and saw, I know that period's very vulnerable for parents, that immediate postpartum. And I don't know, just something about having that small piece to do with that postpartum journey, seeing when breastfeeding clicks and being able to help them when they're in this very, very vulnerable state. I I just love it. I love feeling like I'm setting parents up for the long run. So it took that one lactation consultant to say, "Hey, you could do this and you could really help parents." I dove in, I did all the extra education, and I've been doing it for 7 years now. I I'm never looking back to leaving this. A big part of why I wanted to do that, just because of my own postpartum journey, and just took, again, that one lactation consultant, just be like, "Hey, you've got this," and seeing the difference that it can make.
I would love to talk about some of the most common challenges that you see when it comes to some clients that you have.
There may be a couple days to a couple weeks postpartum. There's two very big challenges that I see. One is pain, mostly due to a shallow latch or just something going on with the latch. And then two, not necessarily a low milk supply, but a perceived low milk supply. And a lot of that stems back to a lot of the social media that we see and kind of those false expectations that a lot of parents start off with. So those are really the two biggest things I see a lot in that very early postpartum stage.
That makes a lot of sense. And as someone who has perceived this kind of expectation of the fridge of milk that you need to have full, or the thought of, how much your baby should be eating based on those charts and graphs and how much you're producing, it can get a little nerve wracking.
And I think that's a big part of it is, social media is a huge part of our lives. And one of the things I did during my doctorate degree, we focused, because my doctorate's in public health. So we focused on how social media and just those false health claims or incorrect information gets out there and how it can become viral. And then it's really hard to combat all of that information that's not evidence based or not research backed. And not only am I there helping moms with getting a comfortable latch and with their position and everything like that, but so much of it is just education and kind of re educating almost, or like redirecting some. And it's because of a lot of those myths that moms.
That is one of the core things at Grownsy that we're going to continue to bring awareness to, is working with professionals, making sure that everything we do relates back to what experts say, and helping parents and really create that village based off of knowledge, support, and connection versus the viral product that is going to help you increase your milk supply and kind of lead into some of those more troublesome narrative. And sometimes we want to be able to hand off the baby to maybe a caregiver at night, or the dad wants to take a night shift in feeding. How do we set people up for success with breastfeeding and other support?
First and foremost, during the daytime, having that partner, whether it's a husband, a wife, a family member, a nanny, whoever that kind of support person is for that mom, having them act as almost like the house manager. So the only thing mom has to focus on during the day is breastfeeding. Someone else is feeding her, someone else is giving her something to drink, and someone's doing the laundry and checking the mail and all the little things that need to be done. Taking care of pets, that's a huge one. So if that support person is able to really dive down and only have that mom focus on breastfeeding during the day, that's going to help establish breastfeeding. So if you're able to really, really prioritize that during the day, there are a lot of families that I work with where some caregiver will take over at nighttime and the baby will be bottle fed at night. But the thing that a lot of families forget about is moms still need to pump overnight. So it still sounds terrible because they still have to wake up, but breastfeeding is very much so a supply and demand. And if you're in those really, really early weeks or days even of breastfeeding, some babies, realistically, very normal for them to breastfeed for 30 or 40 minutes at a time. So some of the avenue when moms will just pump overnight, they can pump for 10 or 15 minutes and then they're done. So they're still able to really optimize the amount of sleep they get at nighttime. And one of the really huge educational points that I do with a lot of my families is paced bottle feeding. It's a very huge educational piece that really helps that transition between breast and bottle quite a bit.
Let's talk a little bit more about how to set mom up for success. And I'll have a question of um, I remember when we first brought baby home and we were trying to breastfeed, and baby latched brilliantly, which was thank goodness, because I don't know what that would have looked like. But the first few days of waking up every 2 hours is so draining. And holding your baby is like another like activation in your brain. So just being able to hand off the baby and pump, I feel like there's something there that like allows you to rest more. Is that true?
It really depends. A lot of that depends on what the milk supply looks like, what the overarching goal is, because it's also important to keep in mind, too, breastfeeding's not always just for nutrition. So it helps for babies to regulate their temperature and their heart rate and their glucose. So it may seem like it's saving a lot of time in those early days where, yes, everyone is just completely exhausted and drained and we're hours of sleep deprivation in. But the important thing to also remember too is it's a very short term, like short lived stage for a lot of these families. So, from the time baby is delivered until about that 4 to 6 week postpartum mark, which sounds like a very long time if you're in these postpartum days, that's really your time to dig in and establish your milk supply and also get into a nice rhythm. Because after that, that autocrine system takes over. So it's very much just a supply and demand after that. So going back to like if that caregiver is able to really like help mom get in that breastfeeding position, help keep the baby awake. So even that helper really helping to keep that baby awake, tickling their feet, tickling their side, something to keep them active during that breastfeeding session, and then being able to pass the baby to them. They can work on those burping techniques or calming and settling and soothing techniques. Those all help too to help mom then anytime that she can get that rest. Even if it's just that hour and a half in between feeds, she knows that whoever she's passing that baby off to, they've got it. They can do their thing. They've got those soothing techniques and they can handle it from there. So that alone even helps. And that's where having that caregiver feed you too, getting in all of those calories is super important. And I do find a lot of moms in those early days feel like, listen, let's just breastfeed a couple times in the morning because our milk supply is higher. And then we're going to pump and we're going to get more rest as the day goes on. And that's fine. We're feeding our baby and we're protecting our milk supply. So I have several different ways that a lot of families take it. It just has to be something that works for that family.
So, when you are learning your baby, because I know for new moms, it's maybe a little bit easier than another caregiver, how much grace should you give yourself when you're trying all these new things?
All the grace in the world. It's so easy to be so critical of ourselves. And I mean, get your whole care team involved. Get any support person in your entire village that you can find and get them involved. Finding finding a lactation consultant prenatally, finding maybe a doula, a prenatal doula, a postpartum doula, calling in the cavalry and yeah, giving yourself as much grace as you can. So even moms that this is their second baby and you're like, "Oh, I've done this. I've got this." Still give yourself grace. They're still different babies and they can be very, very different when it comes to everything. Feeding, sleeping, all.
You mentioned that within the first 6 weeks, you're determining what your milk supply is going to be. What if you have to go back to work at 6 weeks? Do you need to pump extra to kind of get ready for that?
A lot of moms, no matter when they're going back to work, I always recommend starting to add some pumping in about a week before they go back to work. And the goal is only to have enough milk for that first day. It sounds very stressful, but you're still going to pump when you're at work. So the goal would be have enough saved up for that first day, maybe a little extra to give yourself a little wiggle room. But then what you pump today, they eat tomorrow, and so on and so forth. We're just recycling that milk. So that's where some of those social media with having a huge refrigerator stash full of milk, that's not the normal. I personally call them unicorn moms because it's not the normal. It's not something we should expect.
Is there any problem with having that much milk in the freezer? It feels like a lot of pressure to prepare that much milk. And while you say like just pump enough for the fridge for the next day, my anxiety is like, what if we spill it? What if something happens? So if I did want to build a freezer stash, how do I do it safely? Because I know there's also risks, right?
Absolutely. There are quite a few risks that can come with having a very big oversupply. One, first and foremost, some moms feel like they have to be attached to a pump or a baby 24/7. So let's say you're several weeks in and you're really beefing up that amount of milk supply that you have. If your baby's happily going 3, 4 hours in between feeds, which again, that'd be several weeks in, you might breastfeed. And then an hour later, your breasts are very uncomfortable. They're feeling very full. You've got 3 more hours until your baby needs to feed again. But you're like, oh man, like I need to do something to relieve this. So then you pump. And then that's where you get into this very vicious pumping, breastfeeding around the clock cycle. If you don't pump at that time, that's when you're increasing your risk even more of getting something along that mastitis spectrum. So, the Academy of Breastfeeding Medicine did newer research about mastitis. They put it all on a mastitis spectrum now. So, engorgement is the very start of that spectrum. Then we have clogs. Then we have mastitis. And then we even have bacterial mastitis. And then the possibility of an abscess after that. So, it's this nice little like tiered spectrum that they put it on. And you get a lot of those things when you have something called milk stasis, which is just the milk sitting in the breast. So if you have this really big oversupply, that increases your risk dramatically at getting some sort of infection or something along the lines of that mastitis spectrum.
Okay. So you don't want to pump too little, but you don't want to pump too much. How do you find the right rhythm to make sure that you have the right amount of milk there?
It can be. It can be very overwhelming. Things that I recommend to my families I work with when they're going back to work. So, just like we said, about a week before, start adding a couple extra pumps into your day. If you're getting ready to build that backstock, say you are exclusively feeding your baby around the clock, day, night, we're good to go. They're getting everything they need from the breast. Your additional pumping 1 to 2 times a day, typically in the mornings after a breastfeed, that's enough to build that little bit of extra, but not throw us into this massive oversupply. Now, when moms are back to work, typically pumping about every 3 hours that you're away from the baby, only until you get a sense of what do they take in during that time you're away from them, and you just have to pump that much. So if you want to pump that little bit of extra, having somewhere between just a couple ounces to 5 or 6 ounces extra in the day is perfectly fine. That's going to give you that little bit of backstock, but not enough, again, to throw us into that oversupply. So what I see moms do there is sometimes just add an extra pump before bed or keep that extra pump in the morning after a breastfeed. But it's also realistic for after a breastfeed to keep in mind 1/2 ounce to 2 ounces is a normal output after a breastfeeding session, assuming your baby got everything from the breast. So it's very minimal, small increments that you're increasing that backstock. And that's okay. There's never going to be a day where you just wake up in the morning and all of a sudden have no milk. You've had a full milk supply, everything's been gorgeous, and then you just wake up one morning and don't have any. That never happens. So also important to keep
That's good
that
to
in
know.
mind too. Yeah.
For the moms that have figured out how much they need to pump and have a really good routine, but now their baby seems hungrier, how do I increase my supply?
Yeah. So as your baby starts to get hungry like that, you might notice there's a period where they take a bottle or they breastfeed and then very soon later they're hungry again. And that we call that cluster feeding, and it can happen several times throughout infancy. The reason they do that, again, supply and demand to tell your body, hey, we need more milk, we need more milk. So if you're pumping quite a bit and that's the way that we're feeding them, as you're noticing that in the bottles, try to mimic your pumping towards those feedings. We're kind of tricking your body that the baby is cluster feeding. So you can do that by trying to follow as closely along as you can with some of those quicker feeds that they take and just pump like that along those times. Normally it's very short-lived. It's like a day or two. So it's not something you're going to have to do for a month to increase your supply. You could do a power pumping session at a different time throughout the day. Typically, the mornings work the best because your milk supply is higher. But power pumping is it's like an hour-long process. So you pump for 20 minutes, take a 10-minute break, pump again for 10 minutes, take a final 10-minute break, and then pump for a final 10 minutes. So again, all that's doing is just kind of tricking your body at that point that your baby's cluster feeding, and that's going to help increase that overall supply. Also, to put that into a little bit of perspective, as your baby gets older, because we talked a lot about like oversupply and having this whole fridge full of milk, as your baby gets older, they tend to top out, if it's all breast milk, they tend to top out around 4 ounces per feed, with that overarching like 24-hour feed somewhere between 24 to 30 ounces. And that's kind of where they land most of the time, around that 4-ish month mark, until they're done breastfeeding. Whether they're 6 months old or they're a year and a half old, that's still 24 to 30 ounces in 24 hours. That's where they range. So as long as you're making that much milk in 24 hours, you're good to go.
Yeah, because then your baby starts solids and they start replacing meals with food.
Yep, absolutely. Up until a year old, that milk in whatever form is still their main source of nutrition, but your body knows how old your baby is, so it continues to make your breast milk more nutritionally dense as your baby gets older. And your body knows that whether or not you're directly breastfeeding or if you're just exclusively pumping, your body still knows how old your baby is. So yeah, as they start solids, they get into a year old, all that sort of stuff. Yeah, they're still around that 24 to 30 ounces. Our bodies are
The
just
human
magical.
body is incredible.
Absolutely.
How can our how does that bottle handoff look like? And how do we make sure that a baby that takes a bottle still wants the breast afterwards, or vice versa?
Yeah, there's a couple things that families can do. One is doing some paced bottle feeding. So, when you hear about introducing bottles or pacifiers, you always hear about nipple confusion. There's really no such thing as an actual nipple confusion. It's a flow preference. Babies know what mom is, they know what the bottle is. It's a very different feel and texture, structure, but it's a flow preference. Just like us, we're going to take the path of least resistance. So if we are cradling the baby and we are holding that bottle right down for them to take it, gravity is just helping them get that milk. It's very minimal work they have to do. So if we change our approach with the bottle feeding, then we can help protect that transfer. So one of the things that we want to do is really pace bottle feed. So if we have our baby in a seated position or we have them lying down on their side, either way is perfectly fine. But with the bottle, you want to hold that bottle as parallel to the floor as you can. So you just want milk in this very nipple of the bottle. This whole entire thing does not need to be filled. So if you're able to hold it parallel, baby can latch on, they can suck, they have to do the work to pull it out of the bottle. It is still slightly easier than breastfeeding, but when it's held like that, they've got to do some work, opposed to if you're holding it right down and gravity is just pouring it out of the bottle. Now, one of the other things you can do that helps quite a bit when you first give them the bottle, if you tip it up and let the baby suck on it a couple times, then tip it to give them milk, that's that delayed gratification that they get from the breast too. They've got to work at it a couple times to get that milk. So those two things right there really help that transition between breast and bottle. Also helps them so they don't overeat from the bottle too, which can be pretty typical. Because of the shape of the bottle, it goes back so far in their mouth to where it initiates that sucking reflex. So even if they're not hungry and they are very full, it's initiating that reflex. So they're going to
Oh.
continue to just tug at that bottle and they'll take it. We might get gassy. We might spit up. We might show signs of reflux. There could be all sorts of different things. But doing that pace feeding, it slows them down. So it gives their body a little bit of time to respond. And they have more opportunity to be like, oh, yeah, I am full. And they will really start to slow down at the bottle.
Let's make sure that we've set our caregivers up for success, because I know there are probably some crazy questions out there, and listening to this might seem overwhelming. So, what are some easy things to go down? Let's build a checklist for caregivers of feeding while mom's away.
Absolutely. First and foremost, the paced bottle feeding is going to be super important. So, know your paced bottle feeding, know your burping techniques, and also know about warming that breast milk. Not too hot, don't use a microwave, and really just slightly warmer than room temperature.
What about cluster feeding for caregivers? How do you see the signs? How do you keep up? How do you not waste mom's breast milk?
Yeah, that's a big one too. So, when we're cluster feeding, if they feel like they're still hungry after that bottle that they typically take, start giving them more, but in very small increments. Start with a half an ounce at a time and kind of go up from there. Still ensure that you're paced bottle feeding, still ensure that you're burping in between, because that can be a big one with bottles. And also let mom know so that mom knows if she needs to plug in one of those power pumping sessions, either later that night or the next day. That can be really helpful as well.
Let's talk a little bit about warm bottles versus cold bottles and some concerns or dangers with warm bottles that we should be aware of.
Yes. Some tips and tricks. First and foremost, definitely do not use a microwave to heat up breast milk or any type of milk, whether it's breast milk, donor milk, formula, no matter what it is. Absolutely should not be using a microwave. It can lead to some hot spots. that can lead to some burning, and we don't want to burn your baby's teeny tiny little newborn mouth. It can also, if it is breast milk, it can destroy some of those really great components in the breast milk too, if you're microwaving it. So, safe ways to warm it up. There's a lot of different types of bottle warmers out there. There's some really great ones for on the go too. And warming it up, goal is about the temperature that it comes out of you. So just slightly warmer than room temperature. So you could use a bottle warmer. You could use a bowl of warm water. Or if your baby will take it cold, they could also take it cold if you want them to, especially if you don't have a really convenient on the go bottle warmer. But there's tons out there that are really great that sometimes you can adjust the temperature to and all sorts of fun things. But microwaving is definitely a no go. So avoid that. Absolutely.
Grownsy actually specifically makes bottle warmers so that the overheating component is not something moms have to worry about because it can it only takes 30 seconds in a water bath for the milk to overheat. And one of the features of our most popular bottle warmer is it lifts up out of the milk bath. So if you get distracted or something happens while you're warming up the milk, it's raising up and not overheating because it can be so scary to see a tiny little baby's reaction to something that's too hot and you have no idea what's going on and then you feel guilty and then it's just a whole world of problems along with that.
Absolutely. I love that it warms that and lifts it right out of there because there can be so many things. I mean, you've got a crying baby, then they're spitting up, then the dog's barking, like a million things all at one time. That's amazing that it lifts up out of there so it doesn't overheat. That's fantastic.
30 seconds goes by far faster than any of us imagine.
Yeah, it does. Absolutely, it does.
Talk more about feeding on the go because I know that it is all fine and dandy to be able to stay at home the majority of the time with your tiny little newborn, but we have to go to doctor's appointments. And if you have a NICU baby or you have twins, the chances are you're leaving the house a lot more than you would prefer. So,
Absolutely.
how do we feed on the go?
There's several different ways that you can feed on the go. When you have those special circumstances, like you mentioned, like a NICU baby, or you have twins or triplets, something along those lines, it can be hard. It can be hard. We're literally taking everything but the kitchen sink with us when we're walking out the door. So, if you have a singleton, a full term baby, you could breastfeed out on the go using some sort of infant carrier, is my absolute favorite because you can breastfeed right in those. But it's not realistic for a lot of families. And depending on where you are, some moms just don't feel comfortable breastfeeding in public. And that's fine. That's perfectly fine. So, feeding on the go, if you're a mom that doesn't want to breastfeed in public, or if we're using formula or just pumped milk, you could pump immediately before you leave the house. That's going to give you that time. So, maybe you don't need to pump when you're out in public. But using some sort of container that will keep your breast milk cold, that's going to be really helpful when you're out and about. Now, I'm going to talk about the older recommendations that are out there. There is some very new research about breast milk and being safe in certain temperatures. Very new as far as I think it's only like 2 months old. So let's go off of older recommendations just to be safe. So, in general, based on the CDC and the World Health Organization, you've got about 5 hours of freshly pumped breast milk where it's safe just out on the counter. If you have it in the refrigerator, which mostly would be what happens if you're about to run out to a doctor's appointment, you're grabbing something cold out of the fridge, need to be able to take it with us in case baby's hungry. So keeping it in some sort of thermos-like container that will keep it nice and cool, that's going to be super helpful for when you're on the go. If you have to pump while you're out, pumping into a bag or pumping and putting it into a bag and then putting it into some sort of container that will at least keep it at that body temperature, that's still going to give you that 5-hour period. Now, if it's chilled milk and you're going out and you're able to keep it in some sort of container, you've got about the same amount of time because it'll keep it cool for quite a while in that container. And I've seen moms use all sorts of different things.
We have a milk cooler, and I actually have a fun story of I'm glad that it lasts for up to 24 hours because I forgot it in my car after we got out. And I went to check the next morning and I was like, oh my gosh, my milk. I
Yeah.
had completely forgot. And it was still cold enough and I could just put it right back in the fridge.
Oh, I love that. And that's amazing for like traveling and things like that. If it's frozen or if you have those ice packs in there, yeah, you have 24 hours, which seems like a massive amount of time, but is amazing for situations like that. I mean,
Yes.
you're getting the kids out of the car, you're getting a phone call, you're spilt your coffee, like you're doing all the things and that milk
Baby's
keeps it
crying.
in the
I'm
back seat.
crying. Everyone's sad.
Exactly. Exactly. But that's amazing. That's so amazing. So how much does that product hold? Does it hold quite a bit of
I believe it holds
milk?
up to 20 ounces. So if you had to go to work and pump everything, it holds a full day as a pump. And then it actually has two containers that are stainless steel. So you don't have to put them in plastic.
Oh,
And then they can go right into the fridge afterwards.
that is fantastic. That is fantastic. I always recommend to moms to try to get away from the plastic. I mean, the storage bags are fantastic, but if you're able to get away from the plastic, do the stainless steel, do the glass, anything like that. But some daycares don't want glass, which is just silly in and
I
of its
get
own.
it.
But yeah, but that's amazing. I love the stainless steel aspect of it. That's fantastic.
Oh, we also have a portable warmer, which I don't know if you've seen this yet, but we're the first on the market that actually has the bottle that attaches to the warmer base. So you don't have to bring a bottle and a warmer and be pouring milk back and forth again, so that we're not spilling milk anywhere.
Oh, yeah, which is totally a possibility all the time. That's fantastic. So, having that bottle warmer too, I'm assuming you can adjust the temperature or it only heats it so high. That's amazing because, yeah, you could feed a baby a cold bottle of milk. But again, every baby is super picky. Not every baby is going to love that. And if you have a baby that doesn't, those like small on the go type warmers, especially having that bottle that attaches to it, is fantastic. I so I haven't seen that one with a specific bottle, but I've seen one that has different attachments to fit different bottles onto it. So I've seen a whole bunch of different things, but having that bottle and warmer combo right there, it's like a one and done. Out the door, we're good to go.
Can you actually put a checklist together for any moms listening that are like, what do I bring with me if I have to pump and I have to feed on the go? Can you create like a little like checklist that they can go over in their head to make sure they're not forgetting anything?
Ooh, yeah. So if we're feeding and pumping on the go, what do we need? Well, a pump would be super helpful. Wearable pumps are fantastic. However, if you're using those wearable pumps, the batteries could die. You might have forgot to charge it before you left the house. So, always having some type of manual pump can be very helpful and always work in a pinch. There's several manual pumps out there. I do not recommend the silicone ones. Again, that just goes back to research from the Academy of Breastfeeding Medicine. But having any type of manual pump in a pinch can be really helpful. They also don't take up a lot of room in the diaper bag. So, some type of pump, also some type of vessel to keep your milk in. So, if it's like the product that you guys have, the bottle, the warmer, if we can store it in there, fantastic. In a pinch, a storage bag, those are always super helpful. Also, a baggie of some sort to put those pump parts in when you're done pumping so you don't get milk all over the place. And also just to keep them safe if you have to pump a couple times when you're out too. A baggie can be really helpful. Even a reusable silicone, like gallon size bag or something. Those are really, really helpful. And possibly some wipes to specific bottle wipes or pumping wipes to just give it a quick wipe down if you have to pump a couple times out in public. And then obviously some bottles, some nipples, some things like that to be able to feed them. And if you can get away with a cooler bag or something to keep that milk cool as well, that would also be beneficial in case you get stuck out longer than that 5-ish hour window. I think that might be my checklist. I think I got it all.
I think that sounds like enough to, haul around with us.
I know, right?
Oh, let's talk about washing pump parts. If mom is pumping, what is one thing that a caregiver can do to help?
So, caregivers can help a lot with perfecting that bottle washing technique. And if you're able to get them washed, get them dried, even hand washing them if you have to, because sometimes it's faster, getting them washed and dried. The biggest part out of all of that is the drying part of it. And I know that sounds crazy because some families are like, I am meticulously washing this, I am scrubbing this, using all the different bottle soaps. It's the drying that's the really important part. Because if they were to wash them okay, but then not dry them all the way, that little bit of dampness or wet that might be in there, that's where your bacteria grows. So,
Oh,
yeah. So, some of those machines that are the washers, the dryers, the sterilizers, sometimes those work really great to get them dry, but sometimes you might have to like really check them when you're done, make sure they are absolutely dry. So, if a caregiver is doing that, that takes a huge load off of mom right then and there as well.
I didn't know. Was we use the Grownsy bottle washer, and I've just been throwing my pump parts in there because it does the dry and sanitation cycle afterwards. So luckily have never had to worry about that. But I had no idea that the dampness inside, it makes so much sense, but oh my gosh.
Yeah, absolutely. That was something that I learned about more in some of my research with the gut microbiome and breast milk and everything like that was where that bacteria really grows. So even if you have a family, I mean, everyone's sleep deprived. So even if you have that really sleep deprived family and you're saying, listen, after every single pumping session, you have to wash it, you have to do all these millions of things, most of the time the drying goes to the wayside. So if there's anything that any family is going to remember about washing those pump parts, yes, give them a decent wash. But first and foremost, at the absolute end of the day, dry them. Make sure they are dry. Use a towel, paper towel, whatever you need to use. If you have to check them at the end, make sure they are dry. It's the biggest thing that you can do.
So just leaving them out on the counter on the drying rack, not enough?
I mean, that'll dry them, but
Okay.
drying them with some sort of paper towel or something is going to get them dry faster. But
Okay. Okay.
before you twist them all together and put them all apart to pump again, just make sure that they're dry. Yep,
Gotcha. Gotcha. Get those pump parts dry.
absolutely.
Well, Ashley, thank you so much for joining me on this conversation today. I hope that it helped some parents that are confused at home right now and given them a little bit more reassurance.
Thank you so much for having me. This has been so fun, and I really hope that parents do get a lot out of this conversation.
And if there's anything else you would like to hear from us or have questions, leave them below so we can find an expert to answer for you.